I'm Dr. Robyn Paloian. I have been working at the Foot and Ankle Center of Lake City for a few months now, and I'm really excited to be here. I've really enjoyed meeting lots of patients from the area, and working with Dr. Berg has been a pleasure as well. The personalities of the staff and Dr. Berg himself and some of the patients that I met along the way, very positive environment. It's very clean, very professional. It really seemed to be a very good fit for the practitioner that I am becoming. Sometimes Dr. Berg and I will share our opinions even on a particular patient in the office right there on that very day. For example, Dr. Berg might be treating a patient on his schedule in his patient care room, and if I happen to be in the office and if I have a free moment, he might even ask me to come into the room, meet the patient, and give my thoughts on that patient's pathology. And I think everybody wins in that case, because the patient gets two doctors' opinions, and Dr. Berg and I get to share our thoughts with each other. I think it makes us stronger as practitioners, and I think there's a greater likelihood that the patient will have improvement in their case. I really enjoy seeing a broad scope of patients from a wide age range, different walks of life, different kinds of pathologies, whether it's toe or toenail pathologies all the way to ankle injuries, whether it's elective cases such as a bunion or a hammer toe surgery, or even a limb salvage type of case for perhaps a diabetic patient who has had a wound or an infection for a long time, and we're working to save that patient's leg. My training and education was so broad, I feel confident diagnosing and treating for all of these kinds of patients, and I'm eager to help all of those kinds of patients in this office. Some of the patients that I've seen so far, such as young mothers and even teenage patients, I can remember my teenage years. They don't feel that far behind me, and it's fun and refreshing to see those kinds of patients as well. I have background in running and dance, and I enjoy practicing yoga, so when I see athletes or dancers or other performers, I enjoy these kinds of patients because I can relate to them and what their injury or foot problem might be, how that might be affecting their craft, and I not only enjoy talking about their particular interest on a friendly social level, but I also feel like I can really relate and improve their quality of life and in their interest, having the background that I've had.